What is acupuncture used for and how can it help? What is acupuncture used for? Acupuncturists get a question often which is, what is acupuncture used for? Acupuncture is a system of medicine. It provides a method of reaching a diagnosis and prognosis. Even if the treatment is not effective, it still provides insights into the development and progression of illnesses. What is acupuncture by definition? Oxford Dictionary defines acupuncture as a system of integrative medicine that involves pricking the skin or tissues with needles, used to alleviate pain and to treat various physical, mental, and emotional conditions. Originating in ancient China, acupuncture is now widely practiced in the West. Acupuncture, a therapy method under the traditional Chinese medicine system. Researchers will research the acupuncture alone. Acupuncturists usually refer to acupuncture as the all-encompassing therapy, which may also include acupressure, herbal therapy, tai chi and qigong, meditation, and nutrition. Basically a holistic approach to treatment. What can acupuncturists do? An acupuncturist is allowed to engage in the practice of acupuncture, electroacupuncture, perform or prescribe the use of oriental massage, acupressure, moxibustion, cupping, breathing techniques, exercise, heat, cold, magnets, nutrition, diet, herbs, plant, animal, and mineral products, and dietary supplements to promote, maintain, and restore health pursuant to California Business and Professions Code Section 4937.5. World Health Organization and acupuncture. In 2002, the World Health Organization, WHO, published a report called Acupuncture: Review and Analysis of Reports on Controlled Clinical Trials. It provided a baseline of biomedical conditions that may benefit from acupuncture treatment. Research has significantly increased since 2002. Diseases, symptoms or conditions for which acupuncture has been proved through controlled trials to be an effective treatment. Adverse reactions to radiotherapy and/or chemotherapy: allergic rhinitis, biliary colic, depression, dysentery, acute bacillary, dysmenorrhea, epigastralgia, facial pain, headache, hypertension, essential, hypotension, primary, induction of labor, knee pain, low back pain, malposition of fetus, morning sickness, nausea and vomiting, neck pain, rheumatoid arthritis, sciatica, sprain, stroke, tennis elbow. Is acupuncture safe? Relatively few complications from using acupuncture have been reported. 1 NCCIH, a systematic review of 115 studies, concluded acupuncture can be considered inherently safe in the hands of well-trained practitioners. 2 Pain management. Opioids were involved in 47,600 overdose deaths in 2017, 67.8% of all drug overdose deaths. Source: CDC. What is fibromyalgia? Fibromyalgia is a long-lasting or chronic disorder that causes muscle pain and fatigue. Treatment can include lifestyle changes and acupuncture. A systematic review of 12 randomized controlled studies, RCTs, found acupuncture therapy to be an effective and safe treatment and management for patients with fibromyalgia. Bell palsy. Bell's palsy, an acute facial paralysis that can become chronic disorder caused by the inflammation of facial nerve. A meta-analysis showed that acupuncture was associated with increased cure rate and total effective rate of the treatment of Bell's palsy in comparison with drugs. Acupuncture and electroacupuncture can be effective treatments from a clinical perspective. Adverse effects of chemo. Acupuncture treatment is not for treatment of cancer, but rather for the adverse effect of chemo, which may include nausea, vomiting, and pain. Acupuncture was shown in a RCT could significantly reduce GI symptoms induced by chemotherapy and enhance quality of life in patients with advanced gastric cancer. Irritable bowel syndrome, IBS. Irritable bowel syndrome is a disorder of the large intestines. Signs and symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation, or both. Acupuncture showed clinically and statistically significant control of IBS symptoms. Latest research on acupuncture. In a laboratory study, researchers found that electroacupuncture was able to affect a key stress response in rats,